Hi everybody. I have a course coming up on dialectical behavioral therapy, that's DBT. Any interested parties, please feel free to contact me. Classes will be starting soon. Be well. Hi everybody. This is the beginning of a DBT practice workshop, number one. We're going to just talk briefly about the history and development. What is DBT? DBT is dialectical behavioral therapy. Dialectical behavioral therapy was created in the early 1990s by Marsha Linehan. She created a skills training manual published in 1993 and 2015. Her work came out of borderline personality disorder clients and other chronically suicidal clients and otherwise very difficult to treat clients, people who have diagnoses such as schizophrenia and bipolar. What they found in the research was that it actually benefited the clinician and the client, and it helped to improve their relationship because it gave a medium between the client issues and the actual work. This is a highly researched and validated to be one of the most effective therapies for individuals with disorders of emotional dysregulation. It is customizable, so there's tons and tons of different ways to do it, different worksheets, lots of different sections that focus on different types of issues that people might have, and then gives a how-to on how to deal with things with a slew of worksheets, which will be made available as well. This is the what and why of emotional dysregulation, and I'll just read you this quote. The inability, even when one's best efforts are applied, to change or regulate emotional cues, experiences, actions, verbal responses, and/or nonverbal expressions under normative conditions. So, there's a pervasive dysregulation, which would be pretty much feeling triggered about everything all the time. It's also sometimes referred to as generalized anxiety disorder. It's not necessarily situational. It's almost like, overthinking every single thing. An example of an occasional dysregulation would be circumstantial, anything based on circumstance. Feeling overwhelmed because there's too much going on, or there's not enough activity and feeling stressed out about that. Those would not be considered pervasive. Pervasive would fall into the category of disorders and emotional dysregulation, things that are kind of chronic and persistent. A lot of times you'll see this with substance disorders, eating disorders, generalized anxiety disorder, and depressive symptoms as well. What and why of borderline personality disorder? This is the biosocial theory, and this is the bio part of the biosocial theory. A person has a tendency to be highly sensitive to emotional cues, impulsive. Biological influences that can have an effect is hereditary, intrauterine factors, traumatic brain injury, attention deficit disorders and dysfunctions. So I'll just read you this quote. A dysfunction in any part of the extremely complex human emotional regulation system can provide the biological basis for initial emotional vulnerability and subsequent difficulties in emotional modulation. Thus, the biological disposition may be different in different people. So basically, it's just saying that we start out with a different biological base, and so then things are going to have an effect on us from that point forth, partly due to how we were born. The social part of the biosocial theory has a lot to do with early attachment issues. Early attachment interactions play a most important role. So in such environments that an early attachment is disrupted or mismatched between the caretaker and the child, really there needs to be an ability and capacity to validate emotion and model appropriate expressions of emotion. Have an interaction style that reinforces emotional arousal in a positive or fruitful way. And then sometimes you simply have a poor fit between the child's temperament and the caregiver's interaction style, which can in itself lead to early attachment disorders. Early attachment issues occur in approximately 1/3 of all of humans, and so it is very, very common. It's not always necessarily a result of abuse or neglect. Sometimes it can be something as simple as the mother has postpartum depression and is unable to attend to the needs of the child in a relational capacity.
DBT is for everyone. DBT was created for both therapist and client. It's most effective with borderline personality clients. It increases counselors' self-efficacy in clinicians. It's effective with all clients. It gives words, counseling, theoretical approach, plan. It is used for both the clinical and non-clinical settings.